Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. On today's episode, I'm speaking with Dr. Alexandra Sowa. I got that right. Yay. Well, kind of. The founder and CEO at SoWell Health. How are you today?
I'm well. Thank you for having me.
Absolutely. I'm excited. And let's say it. I know we said we weren't going to say this, but everyone, she has a different way of saying her name. So if I said it wrong, for the audience to hear, because I don't want them to think I'm crazy, do that thing that you...
Okay. My name is Dr. Alexandra Sowa.
Okay, just that little A, yeah. You have to roll. It's like you roll out the A. I have to say that because I can't lie to the audience. They had to know that I messed that up a lot of times before we started. Cool. Well, hey, now that we have everyone's attention based on that little rant, thanks for joining us today. I'd love just to kick things off. Tell us a little bit about your background, and then we'll talk about SoWell Health and some of the issues you're working on.
Great. So I am a dual board certified doctor of internal and obesity medicine. I trained at NYU, and I am on a mission to help people unlock their metabolic health to gain long-term health improvements. And my company, as it is today, evolved out of my private practice in New York City. I built a membership practice in weight loss and metabolic health. And I realized very quickly that the secret sauce to what I was doing started off in our first lab draw. And it wasn't even labs that I necessarily even had to order. It was that patients would bring me their outside labs and they'd say to me, my doctor says I'm fine, but I really think something's going on inside, that I can't lose weight or I can't improve my blood pressure. Nothing's budging. And I'd look at the same labs that someone else told them was totally fine. And I'd look at them with my specialty training, and I would quickly identify that not everything was fine, that they had metabolic syndrome, that they had slightly elevated liver enzymes, that they had early insulin resistance. And were their doctors bad? No, their doctors were practicing in what is considered standard medicine, where we don't really identify diseases as they're developing. We wait until they are developed, and then we care about them, then we treat them, then we talk about them. And that preventive health is really just missed in the traditional healthcare setting. So that's my background. That is my mission, and that is where I am growing SoWell Health right now, to help raise early awareness about metabolic health.
Thank you for that introduction and telling us a little bit about your background. Really appreciate it. You kind of fit into some other things I was wondering, right? Like, you're basically your why, how, what, which is great. Mm-hmm. It's always nice when I don't have to ask something, and you tied it in perfectly. So thank you for that. I want the audience to know we kind of want to highlight a couple things today, right? You and I were talking about earlier today. We're talking about how can we do early identification, early detection, I guess, in order to what is it, like, in order for like to have better long-term prevention? Is that like?
Yes. So if you can identify the diseases of insulin resistance, of metabolic health. So let's define that for a second. So 88% of our country is metabolically unhealthy. Only 12% of us meet all metrics of metabolic health. And that's all encompassing. It goes from blood pressure to cholesterol to blood sugar to waist circumference. And that's the truth. But most people do not know that they have something wrong with them until their end stage, until they get all the way to type 2 diabetes and their doctor says, oh, okay, it's time to go on insulin, right? And it takes years to get from having one abnormality of metabolic health all the way to type 2 diabetes. And so if we can raise awareness early and empower the consumer, the individual, the patient, to say, I want to start to understand some of this stuff. And I'm not actually just going to take at face value that I need to get my labs done every 3 years and that I'm okay. If you feel on the inside that something is not optimized, I encourage people to dig a little bit deeper. And a really good statistic that highlights this is that 1 out of every 3 Americans has pre-diabetes, and 90% of them don't know they have it, right? And pre-diabetes is traditionally something that's screened for in a doctor's office. And what I'm talking about is even identifying the pre-diabetes state. And when we do that, we can have this trickle down effect where you're not just touching type 2 diabetes, you're touching all of the diseases that come with insulin resistance. So that is everything from PCOS to heart disease to the pre-diabetes and type 2 diabetes stage. So it's letting people know that they have a right to dig deeper and empowering them to understand some of the data. And saying, like, you can prevent this 20 years before it's a problem. Let's act on it now. If you know it's there, then we're going to give you the evidence-based tools to make the lifestyle changes.
At what point does a healthcare professional provide this guidance, and then the patient just doesn't listen to it, and then they either end up getting these these major health risks, or increasing their chances of the major health risks, or eventually even like dying because of it, right? And I'll just quickly segment this because you're in New York. One of my favorite shows of all time, I don't know if you've seen it, is The Sopranos, right? And James Gandolfini, who played Tony Soprano, was actually, turns out actually he's an amazing actor, but very unhealthy, right? It seems like whether it was to get into the role or just what he was into, right? He loved to eat all different foods. And unfortunately, I'm Italian. The Italian food is delicious, but it is not very healthy for you when consumed in large portions. What can we do? Like, 'cause I'm sure there was doctors at some point that told him, right, that like, hey, you need to maybe get on a better fitness plan.
I'm actually gonna totally disagree with that statement, because I think that actually we don't give patients enough credit. And I think there are very few people out there who actually hear, you must change, and here's exactly, you must change, and then they don't go do it. I think there are two problems in the traditional healthcare setting, which is, one, we don't make it so clear, right? And we don't say, hey, we need to address this so you can reduce the risk of future disease. But then the second biggest problem is that we don't give plans. So in my medical education, I learned in my traditional primary and even through my internal medicine residency, I learned that the advice you would give to patients who were suffering from overweight or obesity was eat less, exercise more. Now, if you tell someone who has a life that's full of a certain sort of foods and is very sedentary to just go home, eat less, and exercise more, the chances of them being successful are absolutely zero. I mean, honestly, you could hear a story once in a blue moon that someone was self-motivated and understood it, but it's very hard to change behaviors if it's all self-directed. And I don't think that we've kind of created the right conversation around these changes. So we don't want to scare people. We don't want to say you're going to die. We want to say, look, you have the ability within 3 months' time to take this elevated hemoglobin A1C, these elevated liver enzymes, and 3 months, I'm going to support you to change this. And then you're going to see how much better you feel. You're going to see you've had validated improvements in your labs. And then let's talk about this idea that you can be more self-directed. It's hard to do hard things on your own. And I think that's where we really let people, we failed them. And from the doctor's perspective, people aren't offering the support because they weren't trained in it. They don't know themselves how to help people. They give a little automated template in their EMR that says, eat more fiber, eat more fruits and vegetables. And it's so depersonalized that is a patient with the abnormal markers who's at higher risk, are they really going to take that home and say, hey, this doctor really created something for me, they really know what's going to happen? No, they probably read it, feel guilty about where they are, and then don't make any changes. So can't always blame the individual. And most of the time, we need to empower them rather than looking at it as a failure to enact change.
I'm glad you mentioned it. You offered your take on that. And also a reason I mentioned The Sopranos is now in the show notes, we get to mention The Sopranos, which is really great because that's going to show up when people search The Sopranos. Look,
great.
right there, right? So, and I don't know why my feed, because I used to watch a lot of Sopranos videos on YouTube. It came up before this call when I went on YouTube. So,
well, can I tell you that I'm working my way through it? I'm only on season 3, so don't spoil it. I mean, I generally know what happened, but let's not go deeper.
Okay, I'll put that in the show notes too. So when you,
okay.
No, I'm just kidding. This has been super helpful. We're just about to wrap up on time. I just want to thank you for coming on the podcast. Hopefully we can have you come on again, kind of dive into some of these additional issues. But this was really for our audience, the Slice of Healthcare audience, to get to know you a little bit, learn about SoWell Health, for us to kind of talk about a couple different topics, but nothing too deep. And we can dive into some of these issues more in future episodes if you're down for it.
Great.
Awesome. Thanks so much.